In care plan recommendations, we finally get to explain what it is that we're going to do for this patient. What are we offering? What are we projecting forward with? But I want to say one more thing as a transition. We're bridging the gap between our last section on future health projections and the current section, which is care plan recommendations. And that is, we want to prompt what I call the demand for care. Prompt the demand for care. How do you do that? The way you do that is you ask a question. Now that you've seen your subluxations and you know how they'll be affecting you in the years to come, how do you feel about your condition and what do you want to do about it? Or where do you see yourself headed in the years to come? Those are questions that will allow the patient, once they hear that question, to say, well, I'm not okay with the direction it's going, and doctor, what I'd really like to know is, what do you recommend? So let's replay that. If I say, how do you feel about your condition and what would you like to do about it? The patient's response would probably be something like, well, I feel not good about my condition. I obviously have a lot of symptoms and health problems, and what I want to do about it is I want to take care of it. So please, doctor, tell me what you recommend. I'm ready to go. I want to get this taken care of. And that's your segue into care plan recommendations, where we can actually explain to the patient what it is we're recommending. Now, what are we recommending? And you all know this, so think about it in your head. What is it that we recommend? And this is our motto for DC trainings. What we recommend is we recommend lifetime care, 1 year at a time. That way the patient can enjoy quality of life, longevity, enjoyment, all the things that we want for ourselves and for our patients. Lifetime care, 1 year at a time. So however you recommend that is up to you and your technique. The frequency, the duration, or sorry, not the duration, but the frequency, how often you're seeing them, what it is that you're going to be doing on each visit, that's technique specific, so you get to decide that. But what I do want you to calculate is what type of a care plan they're going to need in their first year of care. And get ready to explain that to them. And then tie that in with lifetime care. Once we bring you up to this new threshold of health that you're going to love and you're going to enjoy, and you're going to say, why did I take so long to change my health? Why did I even wait this long? Once we get you to here, what would we need to do to maintain that? And the patient's going to say, well, I want to continue to get adjusted so I can maintain that. That's exactly right. We'll be here for you to do that. So in your care plan recommendations, lay out not only the first year of their care and what frequency they're going to need to correct their subluxations, but also plant the seed for lifetime care so they can enjoy the benefits and the longevity that they'll achieve by following your recommendations. Go for it. Don't hold back.